Here now with more on what this new bill means is Dr. Amir Karam. He is a plastic surgeon with an office in Carmel Valley. Good morning to you.
Good morning. Thanks for having me.
You know, I think Donda, her case and her sudden death opened the eyes of a lot of people and a lot of doctors. Tell us about this bill and what it will do.
Well, I think one of the most important things that this case illustrates is that cosmetic surgery is just like any other surgery. It's nothing to take in a trivial manner. It's a serious endeavor. So all the steps that go into any other elective surgery have to be taken in this type of surgery as well. And that usually means a proper history exam, a good physical examination, the proper blood work. And if the patient does have any pre-existing medical conditions, then they would be in a situation where you'd send them along to different physicians to clear them for surgery. And if they're cleared, that usually indicates that the minimal amount of risk is being taken to undergo the elective surgery.
And in the case of Donda West, apparently that didn't happen, and she died of a heart attack from some underlying medical problems that apparently her surgeon didn't know about. So that's kind of the loophole that they're trying to close here, correct?
Potentially, and I don't know all the details in that particular case. It was a complicated case, but that's true. What we're trying to do is in many ways force everyone, and most physicians actually do this. I would say probably 90-something% of them would do this anyway. But doing this is just emphasizing the importance of going through the proper steps.
And tell us about some of the ways that a surgery can be complicated. I mean, even just taking over-the-counter drugs or supplements or vitamins or herbs can affect the outcome of your surgery.
Absolutely, and more and more people are taking different herbal medicines and things like that, and that's important to elicit that information during the preoperative exam, because you're right, a lot of that can cause trouble with bleeding time and things like that it's important to know so the patients can stop those things before they go into surgery.
What are the most common complications that happen in a healthy person during an elective surgery?
Most common complications are things just like bleeding and those type of things. But if the patient has pre-existing heart conditions or things like that, you could run into problems with cardiac arrhythmias and different things like that. But those a lot of times can be picked up early, and steps can be taken to manage those before they get into the operating room.
Now you specialize in faces, but
that's right.
you work with people who do all kinds of procedures. We have some, I believe, befores and afters to show of certain procedures.
Well, exactly. And one of the things that's happening now is most of our patients are coming to, the patients that I see are mostly for facial rejuvenation and rhinoplasty and things like that. And a lot of them are coming to us, they have families and they're afraid of going under general anesthesia because of that extra potential risk that may exist. So they come and ask to have things done under local anesthesia or under IV sedation while they're basically awake. So that minimizes the risk of that surgery. And we do, I would say probably 80% of the cases that I do are done under those conditions.
Right. So just because you're having a procedure doesn't mean you have to undergo general anesthesia. There are ways to work around that.
Especially in the face. Not so much for abdominoplasties and different things like that. Those can be a little bit more complicated cases in terms of being able to do under local, but certainly in the face.
So this bill then, basically, it is really requiring doctors who maybe weren't following the rules and taking these extensive medical histories of patients to do so from here on out.
Exactly.
And the bottom line is it'll be safer for patients.
Exactly. Exactly.
Doctor, thank you very much. Amir Karam, a plastic surgeon here in town. Appreciate your time this morning.
Thank you. My pleasure. Thanks for having us.
Enjoy your day.
Thank you.